Rebecca Wimpey, given recent winter struggles, what do you think is the best long-term strategy for the NHS?
We hear that the winter crisis may be easing, and most people know that it's a long-term problem. I'm going to start with you as, in your role as former Health Secretary, Stephen Dorrell.
And also, as you know, chair of the NHS Confederation, which I've expressed some fairly strong views about Brexit, which I should make it clear. And the Confederation is neutral on those issues. But as far as the funding...
Well, it's neutral about what needs to be done for the long term.
No, on the Brexit issue.
Oh, sorry, on Brexit.
Now, moving to the NHS, what I think is fundamental in the NHS is to understand that you can't deal with the problems of an acute hospital if you don't understand where the demand comes from for the services provided for an acute hospital. That's why I was pleased when Theresa May added social care to the name of the Department of Health in order to emphasise that health policy ought to be about more than just the treatment of acute illness. It should be about ensuring that we have, through our social care system, through our social housing system, through the range of public services supplied to local communities, we should take all opportunities to ensure that we don't merely lead longer lives, but we lead healthier, more enjoyable lives. So just to focus on the NHS is mistake number one. Simon Stevens of the NHS, the Chief Executive of the NHS, made it clear last year we have to look at the system as a whole. And then the second point, and this is what we're doing within the NHS Confederation, is actually to understand the long-term trends. It's no good just saying we need another 100 million a week. That's another example of government by guesswork. What we actually need is an analysis of what the demands are on our public services and the NHS as part of our public services, and then a serious view over a sustained period of how those demands are going to be met, rather than simply responding to the immediate short-term crisis.
We don't have all that much time, but extend that thought a bit. Presumably, amongst other things, that does mean in the medium term a lot more money, given the demographics, people getting older, people living with complex chronic problems into their 60s, 70s, 80s and into their 90s?
Absolutely it does, but it means understanding what the long-term trends are and having a plan for meeting them rather than another piece of sticking plaster.
Francis